good to have you back on this channel. And if you are visiting this space for the first time, you are also highly welcome. Let's look at the superior gemellus muscle. Using this image by the side here, this is where we have the superior gemellus muscle here, arrowed in dotted red. In this lecture, we'll be looking at the point of origin and also insertion of this muscle, and also highlighting some features that you should know as students of anatomy. The superior gemellus muscle is what is harrowed here in green, and this muscle is a triangular shaped muscle that is located within the deep gluteal region. We know that the muscles around the gluteal space are further subdivided into the deep compartment and also the superficial compartment. We've tried to highlight this in our lecture on the gluteal region. You can go and check that lecture up to keep yourself updated. So within the deep compartment, we have a number of muscles, embedded within the deep gluteal space. And this is what is seen here in this image. This deep layer is further overlined by the superficial group of muscles. So for the deep compartment that is exposed here in this image, we have the superior gemellus muscle as one of this muscle, and this is what is harrowed here in green. It's also important for us to describe the other muscles that we have around this space. We already highlighted the superior gemellus muscle here in green. This is what is seen to be positioned around this region, while inferiorly we have the inferior gemellus muscle. The superior and the inferior gemellus muscle are separated by the obliterator internus. And this is where we have the obliterator internus here, harrowed also in dotted yellow. The inferior gemellus muscle, if you try to compare it with the superior gemellus, apart from the fact that the superior gemellus is positioned superiorly to the obliterator internus, the inferior gemellus is positioned inferiorly to the obliterator internus. If you also try to compare them in terms of size, we say that the superior gemellus muscle is smaller than the inferior gemellus muscle. So you have these two muscles separated by the obliterator internus, and this is what is represented here in this image. And more superiorly, at this point that is also harrowed in dotted yellow, we have the piriformis. If you go more inferiorly, around this inferior edge, we have the quadratus femoris. So all these muscles will come together to form the deep compartment of the gluteal region. We say that this deep compartment is then overlined by the superficial group of muscles. This we have highlighted in details in our lecture on the gluteal region. So one of the muscles that you have around the deep gluteal region is the superior gemellus muscle. And we've also tried to highlight the other muscles that are also located within the deep compartment. So going further, let's dive into the origin and also the insertion point of the superior gemellus muscle. The superior gemellus muscle is what is harrowed here in green, and we've already described in our previous slide how it is related to the other muscles that are located within the deep gluteal space. So in terms of origin, it is seen to originate from the ischial spine. Specifically, it is seen to originate from the posterior or the external surface of the ischial spine. This is where we have the ischial spine here, harrowed in dotted black. The ischial spine is a sub-region of the ischium. We know that the ischium is one of the structural components of the hip bone. The hip bone is made up of the ilium, the ischium, and also the pubis. So at this posterior edge here is where we have the ischium. And the specific region on the ischium is the ischial spine. And this is what is harrowed here. So at the posterior region, specifically of the ischial spine, is what creates the origination site for the fibers of the superior gemellus muscle. And this is what is harrowed here at this point. So you see the fibers of this muscle are then directed laterally. And this is where they are finally inserted on the medial region or aspect of the greater truncator of the femur. This is where we have the femur here. This is the greater truncator of the femur, and this is the lesser truncator of the femur. So you see it inserted finally on the medial region or aspect of the greater truncator of the femur. So this is where they originate from, and this is where they are finally inserted upon. It is also important for us to add that the superior gemellus forms the triceps coccyx. The triceps coccyx is a collection of muscles that you have around the deep gluteal region. This triceps coccyx is seen to form a common tendon around this region that is captured here in yellow. You see that these muscles will come together to form a common tendon where they will finally be inserted on the medial region of the greater truncator of the femur. So this tricep causis is structurally made up of the superior gemellus muscle that is harrowed here in green. We have the obliterator internus that is harrowed here in yellow. Then finally, we have the inferior gemellus muscle that is also harrowed here in yellow. So these three muscles will come together to form the tricep causis. And at the lateral end here, they are seen to have a common tendon where they will finally be inserted on the medial aspect of the greater truncator of the femur. So it's good for us to highlight this in case we are asked during examination to describe or list the structural components of the triceps causis. And this is what is represented here in this image. So this is where we have the superior gemellus. So now let's look at the actions of this muscle. This muscle is seen to allow lateral rotation and also abduction of the thigh when the hip is flexed. It also helps to stabilize the head of the femur within the acetabulum. If you consider the pattern by which the superior gemellus muscle runs from where it originates to finally where it is sat upon, you see that it is seen to cross over the hip joint. So if you look deep to this region, we have the hip joint, and we know that the hip joint is structurally made up of an indentation that is referred to as the acetabulum and a rounded head, which is created by the femur. So the connection between these 2 points is what creates the hip joint. And if you look at the pattern of this muscle, you see that it is seen to run across this joint. And this is where it is helping to stabilize and also help to support this joint, thereby helping to hold the head of the femur within the acetabulum. So this is one of the actions that the superior gemellus muscle also exhibits. The blood supply of this muscle is by the inferior gluteal artery. The inferior gluteal artery is one of the branches from the anterior trunk of the internal iliac artery. We've also described this in our previous lecture on the internal iliac artery. It is also seen to receive contributory supply from the internal pudendal artery. The internal pudendal artery is also one of the branches from the anterior trunk of the internal iliac artery. Then it is seen to be innervated by the nerve to the obliterator internus. The nerve to the obliterator internus is one of the branches from the sacral plexus, and it is specifically formed from the ventral divisions of the ventral rami of L5, S1, and also S2 spinal nerves. The nerve to the obliterator internus muscle is seen to also innervate the obliterator internus muscle, and this is why it is so named the nerve to the obliterator internus muscle. And if you look at the position of the superior gemellus and also the obliterator internus muscle, you see that they are close. So you have the same nerve that supplies the obliterator internus muscle, which is the nerve to the obliterator internus muscle, also supplying the superior gemellus muscle, because these two muscles are positioned close to each other. So they tend to share the same innervation. So thanks for watching this video. Let's continue to stay glued to this channel.